Hi, my name is Dr. Lindsay Zabritsky, and I'm a board-certified dermatologist. And I'm here to talk to you today about a very important topic and a very popular topic that I get asked about all of the time is hair loss and hair shedding, how to prevent it, and how to treat it. So the most important thing that you can take away from this talk today is that all hair loss is not the same. And it's absolutely crucial and vital that you visit your dermatologist for an appropriate diagnosis and treatment plan. When it comes to hair loss, there are many different types of hair loss. Hair loss is also known as alopecia. That is the medical term that dermatologists use to describe hair loss, but it is not a specific term. Alopecia can include many different things. It can include hair loss, it can include hair thinning, and it can include hair shedding. And all of those things are very different. When it comes to alopecia, there are many causes of it. The most common ones are androgenetic alopecia and telogen effluvium. Androgenetic alopecia, or age-induced alopecia, which are similar but not exactly the same, are very common. You can see this in your family, so all you have to do is look at your father, your mother, your grandmother, your grandfather, your aunts and uncles, and see if they have hair loss. So typically in men, this is the receding hairline, this is baldness at the vertex of the scalp, this is bitemporal recession, and in women, you can see a widening of the central part. So this obviously can worsen as we age. However, in some families, it can start rather young. So this is the first question I ask people when they come in is, do you have a family history of this? As we age, it's also just very natural that we don't have as healthy of hair strands as we used to. So over the years, we start to notice our hair is not as thick as it used to be, and it is less dense in certain areas. Now, when it comes to hair shedding or hair thinning, another common diagnosis that we see is telogen effluvium. So telogen effluvium is whenever our body enters a state of telogen shedding. So at any given time, about 15% of our hairs are in a state called telogen, which is the resting phase. So for whatever reason, something triggers your hair cycle to send many hairs into this telogen phase, and we start to notice our hair falling out in clumps in the shower or on our hairbrush. Now, this actually is very common after pregnancy, and many women experience this after giving birth. There are also several other causes for telogen effluvium, and that includes stopping or starting an oral contraceptive pill, being hospitalized, being very sick, undergoing a major surgery, or starting a new medication. So telogen effluvium typically starts about 3 months after the inciting event, but the good news is that it only lasts about 6 to 9 months as long as that inciting trigger has been removed. So most of the time, telogen effluvium resolves on its own without any intervention whatsoever. However, there is a very small minority that continue on to be chronic telogen effluvium. And this typically happens whenever that trigger continues, like if you're continuing to take that medication that caused it, or you're continuing to undergo stress. So that's all important things to keep in mind. Now, there are other medical causes for alopecia, and that's important for your dermatologist to diagnose for you. Some examples of causes of alopecia include infection like tinea and STD, inflammatory disorders like psoriasis or seborrheic dermatitis, or autoimmune disorders like dermatomyositis or lupus, as well as things like alopecia areata. So anytime you're experiencing loss of hair anywhere, you must go and see your dermatologist for appropriate diagnosis. Each of those things that I just mentioned have different treatment plans. Therefore, it's impossible for you to treat it at home. Now, let's say you have androgenetic alopecia or age-related alopecia, thinning of the hair, or telogen effluvium, or something that's more common that you're just trying to get your hair to grow a little bit thicker. Here are some things that you can try, and more importantly, things that I don't recommend that you use over the counter before you see your dermatologist. So things that do not work is biotin and some multivitamins that are directly used for hair, skin, and nails. So a lot of those hair, skin, and nail vitamins mostly rely on biotin. Now, no studies have actually shown that biotin improves hair growth whatsoever. biotin can actually cause issues with bioassays and tests like your thyroid or troponins when you're looking for myocardial infarctions in the hospital. So if you do end up taking biotin, make sure to let your physicians know. Now, when it comes to vitamins and supplements, one of the most well-studied ones to improve hair loss is vitamin D. So many people in America, especially if you live in the north, are vitamin D deficient, and just by supplementing your vitamin D, you can see an improvement in hair loss. Now, when it comes to other multivitamins, they may or may not work. If you are vitamin deficient, then taking a multivitamin will help your hair loss. However, if you eat a normal diet full of protein and you have adequate hydration most of the time, the multivitamins don't necessarily help. Now, a product over the counter that really does make a difference and help is minoxidil or finasteride. Now, men typically use this, and many of us are familiar with men using Rogaine, but in fact, most women can use it as long as you're not of childbearing age. So Rogaine works by increasing the amount of anagen hair or the growth hairs in our scalp at one time. Now, Rogaine does take a few months to see improvement. It's not an overnight treatment. However, it does work, and it does work well. One of the caveats to Rogaine, however, is it only works as you use it. So whenever you stop using it, you're gonna go back to what you look like at the very beginning as if you had never used Rogaine. So while it works, it can be time consuming and it is a commitment because it only works while you use it, but it works very, very well. Now, if you're still concerned with your hair thinning or hair loss, dermatologists do offer a few treatments that are prescription or in-office treatments. We offer Propecia, which is finasteride, something like dutasteride. Both of those can help, are not safe for women of childbearing age, but they can be used in women after childbearing years, and they're safe for men with some side effects. Other things we prescribe are spironolactone, and then we have some in-office treatments like PRP, which can be injected into the scalp with hair growth. Now, again, it's very important that you see your dermatologist the second you start to notice hair loss. Some hair loss can be non-scarring, some can be scarring. So the quicker you get to your dermatologist, the better. When you go to your dermatologist, we can properly diagnose your alopecia and give you the correct treatment plan. So please don't waste your time and money on over-the-counter products that are likely not to help or work, and instead go see your dermatologist for proper care.